Mark from Blue Springs told me that there's nothing affordable about the Affordable Care Act. And when it comes to what he and his family are facing, he said that before Obamacare, they paid $246 a month to cover 5 people with coverage that they thought met their needs. Now the premium is $800 a month. There are only 3 people, still only one child, and he and his wife still at home. So for 5 people, they were paying $246 a month. Now they're paying $800 a month. And he says, when we go to the doctor, nothing is covered. We pay 100% out of pocket. In other words, we pay $800 per month only to be told that none of the office visit or the procedure is covered when we decide we need to go to the doctor until the $8,000 deductible is met. He says, really, what are we going to do? He says, they've taken insurance away from us, and the promise that was made over and over again was never kept. Dave, a small business owner in Columbia, says his premiums have more than doubled. At the same time, his business has continually had to raise deductibles and seriously reduce benefits so that people could continue to have insurance at work. As he puts it, President Obama's health care plan is far from affordable. Well, let's see, that's exactly what Mark said. Nothing affordable about the Affordable Care Act. And Dave's increase this year over last year was 40%. At some point, Dave and lots of other employers just deciding this isn't working. We have a group in our state that many other states have, the Older Adults Transportation Service. It's a nonprofit that provides transportation services for older adults. The title is actually pretty descriptive of what they do. The cost to insure their drivers has gone up by $500,000, and the paperwork seems even greater than that. So complex and so cumbersome, the executive director told me, they have to spend additional money to hire a consultant just to fill out the forms to have the insurance that they used to have, and then the insurance doesn't keep up with what they need and what their drivers need, and they have to begin to cut services back to have insurance that even begins to resemble what they had before the Affordable Care Act. So talk about people being left out. There are older adults in Missouri who don't have the same access to transportation they had before the Affordable Care Act.